Hey folks, it's Jacob here. Everyone has their favorite Marvel hero, but today I'm introducing the heroes inside you. Alpha and beta receptors. One constricts, one relaxes, one slows, one accelerates. All coordinated like the Avengers of the autonomic nervous system. These receptors belong to a world called adrenergic receptors. Join me as we tour this world, painting pharmacology in brighter colors. What are adrenergic receptors? They are targets for adrenaline, epinephrine, and noradrenaline, the main chemicals of the sympathetic nervous system responsible for fight, flight, and focus. A quick mnemonic to remember this is A for adrenaline, which is responsible for action, acceleration, and alertness. They are all G-protein coupled receptors and are divided into alpha receptors and beta receptors. Alpha receptors are subdivided into alpha-1 and alpha-2 receptors, while beta receptors are divided into beta-1, 2, and 3 receptors. Think of them like different buttons on the body that adrenaline can press to create different responses. Now let's delve into these receptors. We'll start with alpha receptors. Alpha-1 receptors. These receptors basically constrict and contract. They are located on the smooth muscles of blood vessels, radial muscle of the eye, internal sphincter of the bladder and the skin. Their function include vasoconstriction, causing an increase in blood pressure, eye dilation aka mydriasis, and contraction of bladder sphincter leading to urinary retention. Just use the mnemonic VEC. Alpha-2 receptors. What they do is to stop the release. They are located on the presynaptic nerve terminals, in the pancreas, as well as in the CNS. They decrease norepinephrine release, decrease insulin release, and reduce sympathetic outflow. Don't forget, alpha-2 are anti-release dudes. Now for the beta receptors. Beta-1 receptors. Recall we have one heart. They are located in the heart as well as the juxtaglomerular cells of the kidney. They cause an increase in heart rate, contractility, and renin release. All these would lead to an increase in blood pressure. Think B1 beats one heart faster. Beta-2 receptors. Recall we have two lungs. These guys are located on the bronchi, uterus, liver, and blood vessels. They cause bronchodilation, vasodilation, uterine relaxation, and finally glycogen breakdown, leading to an increase in blood glucose levels. Think B2 breath and break. B3 receptors. B3 equals fat and P. And they are found, you guessed it, on adipose tissue and the bladder detrusor muscle. They cause lipolysis as well as bladder relaxation. Think B3 burns fat and boosts bladder relaxation. Adrenergic activation. Prepare your body to run. Use the mnemonic fast run to remember the side effects of adrenergic stimulation. F for fast heart rate, tachycardia. A for anxiety. S for sweating. T for tremor. R for raised BP, U for urinary retention. N for no sleep. Clinical applications. 1. Why beta-2 agonists are used in asthmatics. Beta-2 agonists relax bronchial smooth muscle, causing rapid bronchodilation. They also reduce airway resistance, making breathing easier during asthma attacks. 2. Why beta-1 blockers and alpha-2 agonists are used in hypertension. Beta-1 blockers reduce heart rate and contractility, lowering cardiac output and blood pressure. Alpha-2 agonists decrease sympathetic outflow from the CNS, further lowering blood pressure. 3. Why alpha-1 blockers are used in BPH. Alpha-1 blockers would block the vasoconstrictory effect of alpha-1 receptors, causing the relaxation of smooth muscle in the prostate and bladder neck, improving urine flow. This reduces urinary obstruction and BPH symptoms. 4. Why alpha-1 agonists are used in shock. Alpha-1 agonists cause strong vasoconstriction, increasing systemic vascular resistance. This raises blood pressure and helps restore perfusion during shock. 5. Why beta-1 agonists are used in bradycardia. Beta-1 agonists increase heart rate and cardiac contractility. This improves cardiac output in patients with symptomatic bradycardia. In summary, alpha-1 receptors are located in vessels, eye, and bladder sphincter. Their stimulation causes vasoconstriction and mydriasis. Alpha-2 receptors are located on presynaptic terminals. Their stimulation decreases norepinephrine release. Beta-1 receptors are located in the heart and kidney. Their stimulation increases heart rate and contractility. Beta-2 receptors are located in the lungs, uterus, and liver. They are responsible for bronchodilation and relaxation of the uterus. Beta-3 receptors are located in adipose tissue and bladder. And they cause lipolysis and bladder relaxation. And that wraps up today's lesson on adrenergic receptors. Simple, complete, and unforgettable. Fun fact: Nigeria has the highest twin birth rate in the entire world. God bless Nigeria. That's it for today. Stay curious, and I'll see you in the next tutorial.